Don't even think about back or neck surgery for a herniated disc until you watch this entire video. If you've been diagnosed with a herniated disc in your neck or back and multiple doctors told you need surgery, pause right now. I'm gonna explain why you probably don't need surgery and which rare signs truly demand it. Many patients come to my clinic terrified and frustrated, having heard surgery is their only option. They say, "Doc, my MRI shows a large bulge or herniation compressing my nerve root or spinal cord. I have pain, tingling, numbness, it even disrupts my sleep and work." But here's the thing, we treat the patient, not the scan. Yes, I review the MRI and X-ray, but the most important step is a hands-on clinical evaluation to piece together the full picture. Here's the crucial fact. Pain alone is not a reason for surgery. Numbness, tingling, or electric shocks down your legs or arms by themselves don't qualify. So when do you really need surgery? We follow international guidelines. Statistics show only 10% of herniated discs require surgery. That is 1 in 10 patients. 90% can heal conservatively. Those 10% usually have 2 red flags. So what are those red flags? Number 1, loss of bladder or bowel control. Number 2, marked muscle weakness like a foot drop or grip loss. Number 3, spinal cord myelopathy, which affects your coordination or balance. Number 4, a coda equina syndrome, where there's something called saddle numbness, new incontinence, and severe leg pain. But here's the thing. Early, mild foot drop can sometimes recover with aggressive non-surgical care, but you need to decide that obviously with your healthcare team. So the important question is, why do some patients fail basic physical therapy? And when I say non-surgical treatment, I mean a complete protocol. Proper medication management, proper physical therapy that includes computerized intermittent mechanical traction, cold laser, and activity modification. Without traction, you're missing the game changer. So let us talk about what mechanical traction does. Now let me explain on the spine model so you can understand what I'm talking about. If this is your L4 and this is your L5, this red thing here is the disc. Now this disc is composed of an outer hard layer and the inner part has like a jelly-like material. This basically acts like a shock absorber. What happens is when this disc material bulges out, it compresses on one of the nerves. You have a nerve root to the right side and another nerve root to the left side, and then you have the spinal cord here. So when this disc material pushes and compresses on that nerve root, you start having pain down your legs or down your arms if this is your cervical spine. So what mechanical traction does, it decompresses the disc just like that, and you can see the disc material shrinking and the pressure is gonna come off the nerve root. Now here's an important thing, this disc will never go back 100%, but we want it to shrink in a way that your pain resolves and the numbness or tingling or sciatica or the pain down your arms or legs goes away. So the traction table basically gently pulls and releases, opening the disc space by 1 to 3 millimeters. This relieves nerve pressure and rehydrates the disc tissues. Watch how the bulging disc retracts as the spine is lengthened. That's how traction shrinks a herniation over time. But that's not enough. You need to have laser therapy in your physical therapy protocol. Laser penetrates deep tissues, it inhibits inflammatory chemicals, and it speeds fibroblast repair. A 5-minute session can cut pain down by 50% and prime your tissues for movement. The next important thing that needs to be in your physical therapy protocol is the use of therapeutic ultrasound and interferential as well as heat therapy. These mechanical waves loosen tissues, the interferential current blocks pain signals, and the moist heat will boost your blood flow and relaxes the muscle that prepares you for the rest of your session. We cycle these each session to attack pain from every angle. Next, there is something called foraminal decompression positioning, where your doctor of physical therapy is going to put you in certain positions to decompress your spine and cause decreased pressure on your nerve root. So basically, these positions will keep your nerve exit tunnels open all day long. One of the most important things that your physical therapy protocol for treating a herniated disc without surgery is using manual therapy and myofascial release. Think joint mobilization, spinal manipulation, those graded glides restoring motion, the use of instrument-assisted soft tissue mobilization tools, which breaks down any deep adhesions, myofascial decompression and myofascial stretching, which is really crucial to restoring proper fascia movement and gliding in your body. Each hands-on session clears the roadblocks that fuel your pain cycle. I also have to talk about dry needling for treatment of herniated disc without surgery. Those thin monofilament needles that are inserted into muscle knots or trigger points, they cause twitch responses and they reset the muscle tone. Local blood flow surges and that speeds up healing. Those monofilament needles also can be inserted around nerves to simulate a healing response for the management of neuromusculoskeletal pain. Patients often feel 50 to 70% less spasm before they leave the treatment table. Need a custom plan or need an evaluation of your case to determine whether you can benefit from proper physical therapy or not? Or a video consultation with me to determine what's the proper physical therapy for your condition? Need a consultation to know whether your disc herniation can be treated without surgery? Book a video consultation with me. I'll review your MRI, clinical findings, and design your protocol together. Link in the description. Now let us talk about the dangers of surgery and anesthesia. Every spine operation carries risk. Infection at the incision, bleeding and hematoma, blood clots, reherniation and scar tissue. At my clinic, every patient I accept has safely avoided surgery. Of course, now there is less invasive procedures or what is called minimally invasive spinal procedures. However, they don't come without risk. Now, here's a very important thing. If your physical therapy was only basic exercises or light massage, it wasn't enough. You need the full protocol. The mechanical traction, laser, ultrasound, heat, positioning, manual therapy, dry needling, and core work. So let us recap. In order to recover from a herniated disc without surgery, you need, number 1, full clinical exam by an experienced clinician, no shortcuts. And this clinician has to have the philosophy of non-surgical treatment. Number 2, the use of computerized intermittent mechanical traction. Number 3, the use of cold laser. Number 4, modalities like therapeutic ultrasound, interferential, heat and ice therapy. Number 5, decompression positions daily. Number 6, manual therapy and dry needling. Number 7, core stabilization exercises. Number 8, tracking your pain, sleep, and activity in a journal. And last but not least, re-evaluation at 6 months before any decision. Why did I say 6 months? Now here's a very important thing. A disc herniation can take anywhere between 2 to 6 months to fully heal. If your disc is mild, it can take about 6 to 8 weeks to heal. However, most disc problems that require treatment can take anywhere between 3 to 6 months. So don't rush into the decision of going through surgery because that is a decision that can affect your life. I've helped thousands avoid unnecessary spine surgery and return to the life they love. So I hope this video has helped you see the full picture and gave you hope. Hit like, subscribe, and share this video to spread safe and effective care. I'm Dr. Amr Ayad. Stay healthy, stay sharp, and most of all, stay happy. See you next time.